Today we are commemorating the World TB Day. As you may be aware, is that we have been having a big problem, it's a real menace, about TB infections in Kenya, and therefore we have come today to commemorate at Kutus, even as we make the public aware of this particular issue that is a real plague in our country in terms of infections, and therefore we really need to advocate and also do what we call public awareness, so that people can bring themselves, or they can come to the health facilities for the purposes of testing, so that we can see whether somebody is infected, and therefore we can do the treatment, because what we know is that TB is a disease that is treatable, and it's quite infectious, and it is treatable, yes, and therefore we have the drugs that will deal with the problem. One thing that we need to state is that Kirinyaga as a county, nationally we have been given, we are expecting to identify 2,800 cases, and therefore this particular last year, 2024, we were only able to identify 1,600 cases, and therefore we have still a deficit of around 1,200, which is now very important for us to tell the public that we need to identify these particular cases in the population. And the most important thing is about visiting our health facilities, not really because you're sick, but you really need to be tested and checked whether you are suffering from this particular disease. Our community health promoters, we have them in the villages, and they are moving around. We have already trained them on issues to do with the TB and many other infections, because we need to prevent our populations from this particular sickness. Currently and today, we have the theme that we can, yes, and TB is treatable, and we can do it, and we can stop TB. And therefore, our populations in terms of our healthcare workers are quite vast with this particular information, and they have been in a position to go to the communities and bring them to the facilities and take this particular test so that we can do the treatment. We have been having the machines that are required, and we want to thank the county government of Kirinyaga, led by Her Excellency, the Governor, Madam Anne Waiguru, because currently we have the most recent state-of-the-art technology to identify TB. We have gotten a machine that is having the artificial intelligence bit of it, whereby after taking that particular X-ray, it brings automatically the results, and it describes the particular X-ray that has been taken, and therefore it may identify very quickly and very exact that one could be suffering from TB or so. We have also other machines that are in our facilities. We call Gene Expert to check whether somebody is having TB bacteria. And we want to appeal to our public that when you have lived with somebody who has suffered TB, you also need to be checked, so that if you do not suffer from TB, or if you are suffering from TB, the right action should be taken in terms of treatment and in terms of curtailing the disease from developing in your body. So therefore, we are happy, and that is the reason why we are here. We are also offering other services in inclusion of taking care of TB. We are also taking other tests from our public, issues to do with diabetes. As you may be aware, that Kirinyaga County is among the counties that have been suffering on issues to do with non-communicable diseases, and therefore we are testing the people for sugars, that is diabetes. We are also testing people on say HIV, and you can be assured that the drugs are there, and we want to tell the public that they should not be worried by the Trump administration, what has already come to our country. We have the drugs. We have been able to receive quite a consignment last week for our population who are suffering from HIV, and therefore the treatment is quite assured. Otherwise, we could also be doing, or we are also carrying on what we call tests for cervical cancer, so that if anyone suffers from these particular lesions, or particular signs that would show that you could be suffering from cervical cancer, we have our cancer center at Kirinyaga, and we are able to take care of our people. So therefore, we ask and request the public that they should come out in big numbers for this particular cause, and also take themselves to the hospitals for general checkup, so that we can prevent quite many diseases and also infections that could be coming in the future in their families. What is very important for us to note is that in the country, depending on the population that we have in any particular county, there is that particular calculation that we do, that you should be in a position, even in HIV, in a certain particular population, because of the statistics that we do, you should be able to know a rough estimate of numbers that you should be able to identify in the public. And that is why still, even when you go to the public, you'll find that we shall be getting some positive cases. And what I'm happy about this particular activity is that sometimes, like now in the 1600 that we got last year, about 227 of them, they became positive for HIV, meaning that there's co-infection. And it's important for us because even the whole of the lot, more than 93% of those people who were found to be having HIV, when we were trying to go for TB tests, have been put on treatment. So therefore, usually there is that particular number for each and every country, each and every county that you're supposed to identify among your populations after the particular formulas and calculations that are usually done. So therefore, we are still quite far from getting to the position of getting the 2800. And when we reach there, now we can be able to say we can be able to control TB well, because all those particular population of sick people will be under treatment.
Various activities in the county, including screening of the people who are contact. We are also making sure that we subject all the patients who come with TB to a molecular test. It is a genetic testing. As Waziri talked about Gene Expert, it can be able to identify whether you're having any resistance. Apart from that, we are also sending their sputum to National Reference Lab in Nairobi to check whether patients are having TB or not, and if they're having TB, whether it is associated on any resistant pattern among the drugs we are using currently. The decline is because sometime last year, there were various issues and challenges, and I think we had a drop because most of the patients did not come because of various issues. And also at the national level, remember when mostly in the National Reference Lab, we had a shortage of some commodities, but since then, in the year 2025, we have already been able to identify more. So we are trying to do outreaches, as Waziri said. You can see the portable X-ray. We are able to go to outreaches to ensure that those we missed in the year 2024, we will be able to get them in the year 2025. So the county government, Department of Health, and our Waziri, Chief and also Director, we have planned to do weekly outreaches. On 2nd, we'll be in Kirinyaga. On 8th, we'll be in Kimbembe. On 9th, we'll be in Sagana. And on 10th, we'll be in Kirinyaga. This is to ensure that we mop up all those people we missed in the year 2024 and get them to treatment as soon as possible, so that we'll be able to curb the spread from one person to the other.
Naitwa John Kelly Ochieng. I'm a TB champion, I'm a lab technician, and I'm a health record officer. So, my journey of TB ilianza in the year 2019, na nilikuwa tu na kohoa, nikawa napuuza, lakini nikikohoa kwangu ilikuwa ni ile persistent cough, and my persistent cough ilikuwa na kohoa, naye nikawa naenda kununua dawa na meza, sioni tofauti. Usiku ikifika natoa joto, ukifika weight nilikuwa napunguza weight sana, mpaka longi nilikuwa navaa haingenitoshelea. So nikawa nimezidishwa sana na nikalemewa. Na ukiona mwanaume amelemewa, ujue hiyo kitu inamuumiza sana. Nikaamua sasa wacha niende hospitali niweze kwenda nikapimwe. Nilipopimwa nikapatikana niko na ugonjwa ya TB. So nilipopatikana niko na ugonjwa ya TB, niliamua nikapimwa na nikapatikana niko na ugonjwa wa TB. Daktari akaniambia nitaanzishwa matibabu. Kuanzisha matibabu, nikawa nimemeza dawa zangu na nikamaliza. So ningeweza kuhimiza watu kwamba TB si ugonjwa, ni airborne disease. Na airborne disease ni kitu iko kila mahali. inaweza kuwa bacteriologically active anywhere. So unless iweze kukushika ndio utajua kwamba uko nayo, but everywhere. Inashika watoto, inashika wakubwa, wasichana kwa wakubwa, hata madaktari sisi. Ikikushika ni vizuri uende ukatibwe na upimwe, umeze dawa na umalize.